Cohort Study Part 3 Learning Objectives. Compare and contrast retrospective and prospective cohorts. Identify essential features and drawbacks of such design. Understand the concept of nested case control study. So, cohort study design options can be classified into three types: prospective and retrospective, which are the most common, and historical prospective. So, prospective design, we start with the present, we assess the exposure, and we follow up for the future until the occurrence of the disease or outcome of interest. Retrospective design, we start looking back at the past with the exposure, and we follow up in the past the patient until the occurrence of the disease. Historical prospective design, we assess the exposure in the past, we assess the exposure in the present, and we follow up the subject for the future. This figure represents a prospective cohort study. So now we recruit eligible patients, we classify them based on their exposure as exposed and not exposed, follow up looking forward, follow up the patients for a specific period of time, and assess the occurrence of the disease. So in the exposed group, some of the subjects might have the disease, some no disease. Also in the unexposed, some have the disease, some don't have the disease. As you can see, if our theory or hypothesis is true, those who are exposed will have the more likely to have higher incidence of the disease compared to those not exposed. This figure represents a retrospective cohort study. What happened in retrospective cohort study is that we go back to the past records and assess a time point where subjects were disease-free. So subjects in the past at certain time point, they don't have the disease. And we measure the level of exposure and we classify the subjects as exposed, unexposed. Then we follow up in the past until the occurrence of the disease. So again, we classify those have disease, they don't have disease, have the disease, they don't have disease. اللي بيصير بالريتروسبكتيف ستادي ديزاين انه احنا بنختار نقطة في الماضي بيكون فيها المشاركين في الدراسة ما عندهم الاوتكم، ما عندهم المرض، بيكون فقط عندهم الاكسبوجر او not exposed، وبنعملهم متابعة إلى أن يحدث المرض أو outcome of interest. Okay, this is the main difference between retrospective and prospective cohort. Example of retrospective cohort, Framingham study. You all know Framingham study, which is a very, very famous cohort study that started in the 1950s and follow up the patients in the 60s, 70s, and it's still continuing until now. The famous Framingham score is based on Framingham study. This is one example of how Framingham study used a retrospective design. So during their assessment of patients, they used to have blood samples. So they put these blood samples in -80 freezing, and then they go back to these frozen blood bank to determine baseline levels of C-reactive protein and then measure the incidence of a coronary heart disease by risky groups. So they go retrospective to certain data where patients don't have chronic heart disease. However, they assess the exposure based on frozen blood bank sample of C-reactive protein, and then they follow up the patient to see when coronary heart disease had occurred. This is an example of a cohort study, retrospective cohort study, in which we assess the association between oral contraceptive use in women and the occurrence of VTE or venous thromboembolism. So the incidence of venous thromboembolism was calculated based on the findings of that 16 per 1 per 10,000 person year of oral contraceptive users was the incidence of VTE. However, the incidence of VTE among non-oral contraceptive users was 4 per 10,000 person year. If we divide their incidence in the exposed versus non-exposed, we obtain 4, which means those women who are taking oral contraceptives are 4 times likely to have increased incidence of VTE when compared to women not taking oral contraceptives. This is an example also of retrospective design. Cohort study features. They can measure disease incidence, as we said. They can study the natural history of disease. So if we go back to the Framingham study, they really studied the natural history of disease, how patients with high-fat diet will develop coronary heart disease, how patients with high salt diet will end up with hypertension, and, and like that. Also, they provide strong evidence of causal association between exposure and outcome. In addition, they provide information on time lag between exposure and the disease. So we have a time lag. We have this duration of follow-up in which the disease will develop. Multiple diseases can be examined. Good choice if exposure is rare, and generally less susceptible to bias compared to case control study design because we have control on all the measures of interest. How about the drawbacks? Drawbacks of this design: takes time, need large sample and expensive, complicated to implement and conduct, not useful for rare disease or outcomes, problems of selection bias at start, assembling the cohort, starting the cohort during the study, loss of follow-up. With a prolonged time period, this will make it risky because there is a loss to follow-up and exposure change, misclassification. Confounding, exposure not assigned at random. Although cohort study design is a strong design, but it's not strong enough as clinical trials because lack of randomization, which is the major strength of clinical trials in general. We will shift gears now and talk about an important term in epidemiology, which is nested case control studies. Nested case control studies are very powerful study design because it's originated from cohort study. So it's a case control study nested within a cohort study. If you look at this figure, we have initial cohort. So we conduct a cohort study for some reason. We have data on the patients. During the data collection process, we collect other measurements. And also, by the end of the study, more than one outcome occur. So we can start by using this as a nested case control. So we have subjects who develop the disease, not the disease of the main disease that we were looking for in our hypothesis of the cohort, other conditions, and patients who don't develop the disease. So we have cases and controls, and we can go retrospective to assess the exposure related to this disease. So it's ideal for predictor variables that are expensive to measure and that can be assessed at the end of study on subjects who develop the outcome during the study cases and on a sample of those who don't develop the outcome, the controls. Why use a nested case control study? Removes recall bias because data are collected before development of disease. If you remember earlier, we said in case control study, the major limitation is recall bias because we rely on subjects to remember a previous exposure that occurred in the past. However, in nested case control, all the measurements were made for the purpose of a prospective design, for the purpose of a cohort study. So we have control on all the data. The subjects don't need to remember anything. All the data are already collected. Also, it allows for time element to be included in case control study. Again, we said that time element in case control sometimes it cannot be controlled. However, in nested case control, again, the subjects at the time of data collection, they don't have the outcome. However, the outcome occur after follow-up for the patients after certain time. That's why we can consider this a major strength for this design. So, if abnormal biological characteristics were found years before the disease developed, these findings could now be attributed to risk factors for the disease. Framingham study, the one that we mentioned during a cohort study, have many nested case control that contributed to major findings in literature. Let's look also, in addition to that, they are cost effective than cohort because the measurements were made. You don't have now to spend money to make measurements again. Let's look at this example, which is this study. It says pattern of declining hemoglobin concentration prior to cancer diagnosis. If you look closer at the design, the investigator said we used a nested case control design. We analyzed a population-based cohort. So the cohort was already there. And then they derive a nested case control from this design. We analyzed a population-based cohort comparison one-to-one registers. A total of 16,375 cancer cases were identified, for whom we selected 161 and 95 controls. And then they compared the measurements to see the effect of hemoglobin on this on the outcome of interest, which is cancer. So this is one example of nested case control. The data are based on a previous cohort study design.